So the question is, what type of solution do you use for an enema? There are many types of solutions that can be used when delivering an enema. Examples include tap water, normal saline, a hypertonic solution, a soap solution, and oil retention solution. So it's important to find out what type of solution is ordered before providing an enema for your patient. One time when I was working on the med surg floor, I had a 1, 2, 3 enema ordered for my patient. I had no idea what a 1, 2, 3 enema was, so I asked my resource nurse and my charge nurse, and they had no idea as well. So I called the pharmacy, and it turns out that a 1, 2, 3 enema is composed of 1 ounce of magnesium sulfate, 2 ounces of glycerin, and 3 ounces of water. So the pharmacy would provide the mag and the glycerin to me, and then I would add the water and then give it to the patient in their enema. So I gave it to her, and oh my God, I have never seen so much poop come out of one person before. My patient was probably 100 pounds dripping wet, and the amount of poop that filled one of those rectangular bins was unbelievable. It was like 4 inches deep. So as you can imagine, she felt so much better after that enema.